Hello everyone, our group will present the internal and external bleeding. So what is external and internal bleeding? For external bleeding happens when blood exists through a break in the skin.
Types of external bleeding. The type of external bleeding can be classified according to its source. Arterial bleeding. Blood spurts from the wound. This is the most serious type because blood is being pumped out at a faster rate, leading to quarter blood loss. This type of bleeding is less likely to clot. Venous bleeding. Blood flows are gushes. It is easier to control than arterial bleeding. Most veins collapse when cut. Capillary bleeding. Blood oozes from the capillaries. This is the most common type of bleeding and is easily controlled. Quite often, this type of bleeding clots off by itself. The body naturally responds to bleeding by A. Blood vessel spasm. The arteries contain small amounts of muscle tissues in their walls. B. Clotting. Special elements, also known as platelets in the blood, form a clot which will seal the hole in 5 to 10 minutes.
What to do when external bleeding occurs. First, protect yourself against disease by wearing disposable latex gloves. If not available, use several layers of gauze pads, plastic wraps, or bags, or even have the victim apply pressure into his or her hands. Second, expose the wound by removing or cutting the victim's clothing to see where the blood is coming from. Third, place sterile gauze pads or clean cloths, handkerchiefs, washcloths, or towels over the entire wound and apply direct pressure with your finger or palm. The gauze or cloth allows pressure to be applied evenly. Direct pressure stops most bleeding. Fourth, if bleeding does not stop in 10 minutes, the pressure may be too light or in the wrong location. Press harder over a wider area for another 10 minutes. If bleeding is from an arm or leg, elevate the injured area above the heart's level to reduce blood flow. Elevation must be used in combination with a direct pressure over the wound. Fifth, if bleeding still continues, apply pressure at a pressure point to slow the flow of blood, in combination with direct pressure over the wound. A pressure point exists where an artery is near the skin surface and where it passes close to a bone against which it can be compressed. Sixth, after the bleeding stops, or if you need to be free to attend other injuries or victims, apply a pressure bandage onto the wound. Wrap a roller gauze bandage tightly over the dressing above and below the wound site. Seventh, treat for shock by raising the leg 8 to 12 inches from the ground and covering the victim with a coat or blanket to keep the victim warm. Eighth, check circulation in an arm or leg by monitoring the pulse and using the capillary refill test. Ninth, when direct pressure cannot be applied because of protruding bone, skull fracture, open fracture, or embedded object, use a donut-shaped ring pad to control bleeding. Make a ring pad by using narrow bandage, a roller, to form a loop around one hand by wrapping one end of the bandage several times around your forefingers. Pass the other end through the loop and wrap it around several times until the entire bandage is used and a ring is made.
What not to do when there is bleeding. First, do not touch the victim's blood with your bare hands. It should be a last resort. After the bleeding has stopped and the wound is be cared for, wash your hands vigorously with soap and water. Do not use direct pressure on an eye injury, wound with an embedded object, skull fracture, or open fracture. Do not remove a blood-soaked dressing. Apply another dressing on top and keep pressing. Do not apply a pressure bandage so tight that it may cut off circulation. Do not use a tourniquet. They are rarely needed. A tourniquet can damage nerves and blood vessels and may cause the loss of an arm or a leg. If used, apply wide, flat materials.
Internal bleeding is a loss of blood from a blood vessel that collects inside the body. Internal bleeding is usually not visible from the outside. Signs of internal bleeding may take days to appear. Number 1. Bruise or contusions of the skin. Number 2. Painful, tender, rigid, and bruised abdomen. Number 3. Fractured ribs or bruises on chest. Number 4. Weakness, dizziness, and fainting. Number 5. Rapid pulse. Number 6. Cold, moist skin. Number 7. Vomiting or coughing up blood. Number 8. Stools that are black and contain bright red color.
What to do for severe internal bleeding? 1. Check if the airway is open and the victim is talking. Check the victim's breathing and circulation by feeling the heartbeat at the side of the neck and a check for a spinal cord injury. 2. Expect vomiting. Keep the victim lying on his or her left side to prevent vomiting for drainage and to protect the lungs from inhaling the vomit. Do not give the victim anything to eat or drink. 3. Treat the victim for shock by raising the victim's leg 8 to 12 inches and cover the victim with a coat or blanket to keep warm. 4. Seek medical attention immediately.
One. Apply an ice pack over the bruised area for 20 minutes. Protect the victim's skin from frostbite by having a wet cloth between the ice and the skin. The wet cloth transfer cold better than a dry one, which insulate the skin. If the bruise is on an arm or leg, raise it if it's not broken. If an arm or leg is involved, apply an elastic band-aid with a pad over the bruise and between the band-aid and the skin. That's all for today. Thanks for watching.